I don't know if I think we did talk about it a little bit, and I don't necessarily need to say without violating HIPAA, but grateful patient giving, this is where we're gonna talk about there's Dawn. They really want to know about grateful patient giving. But grateful patient giving, I think there's always that topic of, okay, the ethics of it all, like, getting the list of everybody who was treated in the cancer center, getting a list of all the MRI patients, or kind of those things sometimes can be hard. Legally speaking, right? Fundraisers are allowed to get that information for fundraising purposes. But and I was reading some studies on how people felt about it. And no one's ever going to be happy about you looking up their information. That's just not going to be the case. But what's good about it, and what maybe you tell people, and you shouldn't really tell people, is that you're just trying to make sure that you communicate with them properly. Just like Susan was saying earlier, the nurses told them that this person, don't talk about this, or, maybe not, don't go after them because they're more sensitive. It's good for you to have that knowledge before you reach out to them, because there might be the millionaire next door, or the person that, maybe she can only give you $20 a month. But she's so grateful she still wants to give it to you, right? Like she let her feel involved. Give her the opportunity to make an impact on the rest of the community and make an impact with just her little donation that maybe it might be more later. And so I think communicating with patients is important for you. Again, because you just want to let them know that this is their way to leave their legacy, to, leave their mark on society. I know my mom, she just wants to be heard that time. Like, what are you talking about? Okay. I know she doesn't talk about tennis all day, every day. You come into my house and there's tennis on. But communicating with patients. Does anybody, and I don't think you would, does anybody try to get doctors to do this situation, to have the doctors give you information or talk to patients or give brochures? Is that, I don't think so, because I just don't think it's ethically right. So how do you get people to see that there are ways to give if they've had such great service? So, it's part of the discharge papers and has all that information when they discharge. Okay. Anybody else do that? Be part of their discharge paperwork?
Does that seem to work for across the board for like all of the areas? Because I know like our women's and children's department, they come home with like a whole this stack full of paperwork between how do you file your birth certificate, how do you know if your kid needs to be fed, like does it seem to be like as effective in some specialties versus others? Do you know that information? Okay. Sorry. No.
My goal is to get it. My goal is to work with physicians so they can pick up cues, but there's a way in our EMR system that they can mark if it was a grateful patient. And then it is printed in the discharge paperwork, and then the foundation will also put out on that individual. That's my goal.
Oh, that's interesting. I don't know anything about this. So they, in the chart somewhere, there's just like a little click here if this is the.
Have you had conversations with docs about that?
Not yet.
Yeah.
So I learned this at the AHP conference that I went to. And there's other hospitals that are using this EMR system for them to trigger this for people.
Yeah.
I think I alluded to that earlier. What EMR do you guys get? Yeah, and I alluded to that earlier because our patient demographic is just really across the board. And so if we can have the healthcare staff actually identifying for us, that alleviates some of that work.
Yeah. I like it. I feel like it's not too much work if it's something that they're, kind of going through anyways. again, you still haven't implemented.
Implement, yeah, I was waiting for this wonderful person.
It's gonna be great. It is, it's gonna be great. Anybody else have a method that they do? They could do, or they thought about doing, and you just kind of want to bounce that idea off everybody? This is the best place, I mean, obviously, that like, if I wanted to give you do you think the docs would even want to do it? Cause I think if you make it easy for them, it won't be too bad. But then it's also training, right? And you have to have the time to be like,
Well, the
hey,
nurses, they're nurses, they can tell them it's not grateful patient and do the same thing. We're
Mhm.
actually, I'm part of a yellow belt project at a hospital and I'm in the internal medicine clinic and we're working on ADS. Making sure that all patients are getting their ADS, which is their after visit summary.
mhm,
And so collaborating with the doctor, the nurse, and then the case management staff to make sure they're getting that. So that's just an alignment with that and it's in there.
thoughts? Anybody opposed to that? Just curiosity, if there's a devil's advocate. I think it's great. I like it. You're the first one that mentioned, just being part of the EMS system and having it, something that will let it generate. This is using the systems and software we have in place already to make our lives easier. It's great. All right. Any other burning questions that we didn't talk about during the grateful patient conversation earlier that you might have? I Caleb's taking so much notes in here, so did you have any questions that?
So many questions. No, not right now, just because. Just trying to wrap my head around everything. I just don't want to go too deep into something. Then I'll forget about it. But just write as much as I can.
Okay. I know that, Caleb, you're gonna get everybody's email addresses and stuff, so take note of who you wanna talk to first, make a priority list.